Hi, this is Jennifer Henke with Organic Baby University and here at Whole Pregnancy. And today we're talking again with Dr. Sears, the author of the vaccine book and the autism book. And we're talking a little bit more about vaccines and some common questions and concerns that parents have. And today we're going to talk about specific questions or comments that you may hear on the internet or misperceptions that he's going to try to clarify for us. So first I want to thank you so much for joining us today.
You're welcome. It's great to be back. Thanks.
Okay, well, great. Well, I just want to jump right in then and start asking some of the questions that so many parents have or that you hear kind of going back and forth between I hate calling pro-vaccine and anti-vaccine because I think there's so much gray area there because I think that so many parents just question vaccines. But anyway, that goes back and forth on those kind of topics. So the first is can you catch the disease from the vaccine?
That's a great question, and there's one very important misconception I'd like to clear up in that the polio vaccine that we used to use, the oral polio vaccine that was a live vaccine, you could catch polio from that. And that was probably the worst example, the most dangerous example of where you could catch a disease from a vaccine. And that has scared a lot of parents away from all vaccines. But that's really the only example in recent years where that was possible. Now we don't use that vaccine anymore. We haven't used that vaccine for at least 15 years, I think. And so with today's polio vaccine, there's no way you can catch the disease from the vaccine.
What about live virus vaccines? Because that's what I typically hear is it's the live virus, like the MMR, that you can actually catch those from.
Yes, there are some examples where you can catch the disease. The MMR or measles, mumps, rubella vaccine, it's possible with that one. It's possible with the chickenpox vaccine. There are two vaccines that are actually designed to give you a mild case of the disease. One is the infant rotavirus vaccine, and the other is the live nasal flu vaccine. Those actually give you a mild case, so your body responds to it and creates immunity. But with all the vaccines today, in which you can actually catch the disease from the vaccine, those cases of the disease are actually fairly mild. They're rarely problematic at all. And so I don't consider that to be any sort of danger. It certainly can be a nuisance, but I don't consider that a valid reason to stay away from those vaccines because it's really not a dangerous situation anymore.
Well, okay, but if you could catch it with a mild case, for example, could you actually give it to somebody else and they could get a severe case?
Yes, that is possible. Yeah,
Okay.
if you actually catch a real case of the disease from the shot, you can transfer it to others, and they can have any type of case from that sort of exposure.
So what is shedding, and is that shedding when somebody else gets a vaccine and then somebody catches the disease from that? Is that what that is?
That's actually a different situation.
Okay.
I was sort of referring more to you actually having a contagious form of the disease.
Thank you so much for joining us today.
Oh, you're very welcome. I'm glad to be on.